Hi, everyone. Welcome back. Today, we're joined by Rusty Rohr, an RN from Dixie Regional Medical Center, to talk about his experience as one of the 100 caregivers who were sent to New York to help the fight against COVID-19. Rusty was sent to our Northwell unit, the Long Island Jewish Medical Center, and he worked in the cardiovascular ICU. Rusty, thank you so much for joining us today. We really appreciate it. So, Rusty, tell us. Yes, we're very excited to talk with you today. So tell us a little bit about what you do in your normal day-to-day at Dixie Regional.
So at Dixie Regional, I work in the intensive care unit. We're a mixed ICU. So we take care of medical, surgical, cardiothoracic, neurotrauma, things that in larger hospitals might be taken care of by 4 or 5 different ICUs. So I'm a staff nurse there. I'm also a charge nurse. I also am the liaison for the cardiothoracic surgeons. So day to day, I sometimes I charge, sometimes I work as a staff nurse. So day to day is taking care of critically ill patients. You end up kind of being a jack of all trades in the critical care environment. And it's nice because you're sort of broadly educated in critical care.
And how long have you been working there?
Almost 5 years.
Okay. So when you first heard about this experience of volunteering to go to New York, what was the first thing that went through your head? What are some pros and cons that you were thinking about, and why did you ultimately decide to
go? In all reality, I had actually already considered going to New York prior to this opportunity. See, we'd already made adjustments to our elective surgery schedule at Intermountain Healthcare and certainly at Dixie. So our census was low because we had already begun to make accommodations anticipating kind of an influx of COVID-19 patients. We were reassigning nurses to cross-train in critical care and other locations. So our staffing need was somewhat low. Yet in the meantime, we were reading every day that the need in New York was tremendous, that they were overwhelmed, that they were understaffed. I had even inquired about a leave of absence, but I think Intermountain Healthcare was concerned about having critical care staff leave at a time when it was uncertain if we ourselves would be overwhelmed with COVID-19 and then end up being short-staffed. So this was really a wonderful compromise. Those of us who were burdened to go and work where there was a need that we saw, a great need, were given the opportunity to do so. And then Intermountain as an organization was able to contribute to that effort. And the added perk for everyone was that we had the organizational strength of Intermountain Healthcare. They arranged all the details. We then had the camaraderie of working with some of our colleagues that we already knew. We had the shared vision. We were able to debrief sometimes in the evenings with people that we traveled with. This was a huge bonus. It allowed us to constantly encourage one another, things that you would have missed if you'd gone out there solo.
So have you been to New York before, by the way, or was this your first experience there?
I had been once before. I can't remember, maybe 10, 15 years ago on a business trip. I went to a convention. I don't even know where the convention was. It was 2 days. The only sightseeing I did at the time was I went and saw the 9/11 memorial. Before they built anything, there was still a big hole in the ground.
So for this experience, it was your first, I guess, experience there, when it's a little bit different than normal. As if you've been to New York before, you said you went there for a conference, you probably didn't experience as much of the hustle and bustle of New York. And it sounds like when you all went to New York this time, it was that same way, where it was very quiet and eerie. Can you tell us a little bit about that experience, getting off the plane and the first time you were in New York, seeing the impacts of COVID?
Oh yeah, I mean, it was night and day. Even though the last time I was there for only 2 days and mostly at a conference, I mean, I did walk to a restaurant and it was just chaotic. I mean, there was just people everywhere, and you just people watch the whole time. You're like, man, there's so many people. There's somebody everywhere. This time I actually can't remember if I flew into JFK last time. I assume I did, but it was weird, flying into one of the biggest airports in the world and having it be pretty much empty, walking down huge corridors and the little flat escalators, can't remember what you call them, just the moving sidewalk kind of things to help you get along quicker in the airport. Just barely anybody there. It was peculiar, kind of apocalyptic movie type scenario where you're like, where is everybody? This place should be packed. They had some
Yeah,
people that greeted us. They were great.
I can't imagine what it must have felt like with that experience. I know that not a lot of people are traveling by planes right now, so I can't even imagine the thought of wearing a mask on a plane, or even just knowing that you were going to this atmosphere that was so different. Can you talk a little bit about what your responsibilities were at the hospital? I think I'm saying this correctly, but it sounds like that hospital had 85% full of COVID cases. Is that correct?
I think it was at least that. I actually don't remember if I was ever told a specific number, but by far the vast majority of patients were COVID patients. Everyone I took care of was a COVID-19 patient.
And what were your responsibilities there? What were you put in charge of, and how did that work going to a different hospital system than what you'd been used to?
Well, it's interesting because just in terms of the response when we got there, um, Northwell Health was the hospital system that we were working with, the group that I went with at least. They were very gracious. Their demeanor, all the details they took care of, from food arrangements and travel and other things they helped with, was evident. They were very grateful we were there. They had been under a lot of pressure. Interestingly enough, though, I think if you talk everybody's experience with clinical staff, because as a nurse or a respiratory therapist, we're kind of at the basic patient care human level. Everyone got different responses, and different levels of appreciation. I had the privilege of being in a small cardiothoracic ICU. It had 12 beds, so for me that was a somewhat familiar environment. Nonetheless, it still took time to get acclimated. That means, the first week I was there, I had to ask somebody a question every 20 minutes. And you have nurses that are already overwhelmed. And I definitely noticed anybody who's ever been a student nurse or oriented or precepted knows that it's frequently, and this is a stereotype, critical care nurses are very particular about how they do things. They're particular about their schedule, about their rhythm. And I think the first few days, I really felt like I was interrupting people's schedule. Like they're like, we're already busy. We already have too much to do. And now I have to help you. And you're only going to be here 2 weeks. So you got a different reception at a corporate level than you sometimes did at a clinical level. But one of the things that I did was I worked the first 7 days I was there, I worked every single day. And what that allowed me to do was to just develop rapport on the unit that I was at. After I was 4 or 5 days in, I could do most of my charting. I knew where most of the things I needed were, and I could basically take care of patients and offload some of the nurses who'd had 3 or 4 critically ill patients that normally they would have staffed 1-to-1. I would just go in each day and I would take a patient from one nurse and a patient from another nurse, lighten their load. And I found that after that first week, the respect and appreciation of the clinical staff really skyrocketed. In terms of my responsibilities, like I said, I was in a cardiothoracic ICU, but the reality is everyone there was a COVID-19 patient. They weren't doing cardiothoracic specific surgeries. What was distinct was when I left, 12-bed unit, 7 of the 12 patients were on ECMO. We don't do ECMO at Dixie Regional Medical Center. ECMO, and I know we do it at Intermountain Medical Center in Murray. I don't know I think that might be the only facility in all of Intermountain that does ECMO. So you have the sickest of the sick receiving, assistance with oxygen exchange beyond the ventilator when they're on ECMO. So what I typically did was I would take 2 patients that were not on ECMO and I would take care of them. And then I would assist the other nurses because I could still manage drips and titrate pressors and things that were needed to assist with the critical care. I just didn't have the skill set to manage the ECMO patients. So they became actually very grateful. I find that, you go in there ready to work and ready to help, and with that attitude, sort of unapologetic. And it takes a few days for people to believe that that's really your intention. But you help change a couple people that have messed their beds or things like that, and people go, okay, you're for real. You're here to help. You don't mind getting your hands dirty. So I took care of critically ill patients in a typical ICU setting, and respiratory failure, renal failure, um, administering medications and titrating drips to help maintain blood pressures, ventilator management, those things that you would do in a critical care environment. Um, so those are my responsibilities.
And when you were there, do you remember seeing or experiencing something that made you think, wow, like COVID-19 is a serious disease? Because at that point, when you guys had left, Utah hadn't really reached this critical point yet. We were still in this, we know it's real, we know it exists, but we hadn't experienced a lot of the heartbreak yet. Was there something that happened to you that you want to share that kind of made you think, okay, everyone needs to be taking this seriously?
That is always the challenge, is whenever you read something that seems far away in the news or you watch it on TV. It's I suppose it's human nature to kind of remove yourself from it a little bit. And I certainly, because we're in clinical practice and we're in the hospital, and I'd already taken care of COVID-19 patients, just far fewer in number. um, it was perhaps eye-opening to see it face to face, where an entire community was overwhelmed. So yeah, just it was interesting, mostly talking to the clinical staff, because they said literally it was like one day things were what we're accustomed to, and within 1, 2, or 3 days things, it literally exploded. And they were they were they said they were just in complete shock. It actually seemed surreal to them the first few weeks, and they by the time we arrived, they had certainly settled into a groove of, this is the way life is for this season, however long that's going to last. Um, for me personally, um, it was it was it was difficult to understand how and why it impacted so many people so differently. Um, so, for example, in the 3 weeks I was there, I had 4 patients that were my patients personally that passed away. Now, even though I work in the critical care and I have people pass away, um, it was every day somebody in a little 12-bed unit. Almost every day somebody passed away, and that was odd. I'm in a 36-bed unit, and if you could imagine, by comparison, me having 3 people pass away every single day, I mean, it would just overwhelm the emotions and the the human side of the equation of just providing care. But I think one thing, in terms of specific things that happened, I one thing that really hit me hard was I had they'd called a rapid response out on the floor. That's where a team goes, and frequently, if those patients are deteriorating in terms of their clinical presentation, they get brought to the intensive care unit. And I had a lady brought to the intensive care unit. She was about my age, in her mid 40s, and she was alert, oriented, appropriate. Had come in with, from her perspective, a cold. I got a cold, had a cough, um, and she needed, she was at a point, her respiratory status that she didn't appreciate, but she needed to be intubated and assisted with her ventilation. So we got her set up, drew labs, and I left for the evening, and she passed away hours later. And I was in shock when I came in the next morning. I expected to take care of this woman that I'd helped settle. I mean, I talked to her. She was alert, she was oriented, she was a little bit, and she was teary. I remember she said to me, she said, she was scared. She said, I don't want to die. I said, right now, sweetheart, we're just going to take care of you. And I was in shock. I just was, I was, when things happen out of the ordinary, out of your ordinary experience, I should say, So this is the same kind of thing that happens when, a young person gets in a trauma in the community. St. George is a relatively small community. The kid gets in a bike accident or motor vehicle accident, and you lose them. It just tugs at your heart because um, it's so unexpected, and you have all these dreams and hopes, and we really dwell on that when we imagine what somebody could have done with their life, or the opportunities, or the impact that's going to be lost through losing them. And in the same way, I think uh, having two of the people that I lost to COVID-19, uh, I didn't expect to. They didn't fit the demographic that I've been told was kind of, the highest risk. They were moderate to low risk, and that was hard. And then you couple with that the reality that there were almost no visitors available. Um, the other person that really impacted me was that I had taken care of a gal for 3 days, and I had been on the phone with her family for 3 days. And in terms of labs and things, her health seemed to be improving. And then that third night when I left, she also passed away in the middle of the night. And I came back the next day and I was in shock. I said, "My goodness, I just spent 3 days telling a family that giving lab results." Because when a family's had someone in the hospital for a while, they start to ask about certain labs and numbers that they've heard are important, and those things seem to be improving. And then this woman codes and dies in the middle of the night, and she was only a few years older than me, and I was heartbroken. I had my own concerns. I was like, did I give this family false hope? Did I, create expectations that were above what they should have been? I didn't do anything different than I would have done in the same context at home, but the result wasn't what I expected. So I think really trying to manage, one of the hardest things is not having visitors in the hospital, is that family didn't get to watch the progress or or lack thereof. They were completely dependent on your verbal reports. And so sometimes when people passed away, it left people in complete and utter shock, because uh, the reports may have not seemed quite that dire in the process, and they weren't there to see their condition if they were deteriorating. Many of these people were brought in by family with a cough or a cold or a fever, things that historically would have seemed routine, and now they don't get to see them from the time they first had a symptom till they pass away. That was one of the most challenging things, was trying to um, sort of interact with families who didn't get to be there face to face and see their loved ones. That was tough.
Everything you just said was really sobering to hear. I think hearing it from someone else's perspective, I mean, I've read everything that you guys have talked about from New York, but hearing you talk about that was really intense. It is crazy to think that people come in with just simple symptoms and then that could happen to them. I do know too that you actually ended up staying in New York longer than the 2 weeks that the rest of the team did. What made you want to stay and continue to help out in New York?
Well, this, as I mentioned, when I first got there, I worked 7 days in a row, and I did that for two reasons. Um, the number one thing on my mind was, and this is a quirk of the industry. Like I said, I've precepted a lot of students, and I've worked with a lot of student nurses, and I remember being a student. And one of the things that I remembered about being a student was that sometimes clinical staff that's training you makes it evident that they don't really want to be training you, that you're an interruption in their routine and their schedule. And I think if you talk to any student, they've all had that experience. So I really, whenever I train students, I set my heart on, how do I make them feel welcome? How do I make this a learning experience? How do I involve them? And I let go of all my schedule, I got to get this done in this time frame, and I just focus on patient care and training somebody, because I know how important that is, not only in terms of the development of their clinical skills, but in terms of their overall experience. People go into nursing because they want to take care of people. It's a nitty gritty, take care of people at their most vulnerable kind of job. And so I know that it takes time to develop rapport. And so I knew I was going there as a competent intensive care unit nurse. But I also knew that if I only worked typical 3 12-hour shifts a week, that I would, and I was there for 2 weeks, that I would only put in 6 shifts, and that I would probably barely know what I was doing by the time I left. That was my fear. And I wanted to be as helpful as possible. So I felt like after that first week, I finally became useful, at least in the eyes of the people that I was working with. They saw me there every day. They saw my work ethic. None of them were working 6 or 7 days a week. They had been overwhelmed because of their patient load, but that most of them weren't even picking up an extra shift because they were burned out. And so once I was there a week and I worked every day, there was a transition in their respect. They're like, man, you've been here like every day. You doing okay? You getting enough rest? I said, yeah, I'm doing fine. I told them, I said, I'm here for 2 weeks. I'm your slave. I'm here to help you guys out. I said, I can suck it up for 2 weeks. And so after that first week, as I started to develop rapport with the unit and I felt useful, I thought, well, now that I'm useful, I should at least put in 2 weeks of useful, appreciated work. So I just talked to the gal that had was kind of arranging my work on the unit, and I said, hey, could you guys use help for another week? And they said, yeah, of course, that would be great. And so we ended up being able to arrange it with Intermountain. I don't know how the details happened, but they were okay with it, and we were okay with it. And they did give me one warning. They said if I stayed there more than 2 weeks, that I would have to pay New York's taxes. I think Governor Cuomo set that up, and I think it probably irritated a lot of people who had traveled to New York. But I really didn't care at that point. I was already there. I was in a groove. I felt like I was doing something that mattered and helping where there was a need. And really amazingly, even though I didn't sleep that great, I was away from home and whatnot. I felt pretty good the whole time, and I was grateful to be there. And they became very appreciative of me. They gave me a nice card and some gift certificates for my kids as a thank you for being there. So I really felt like that extra time it allowed me to develop friendships, not just with my colleagues here at home, but with a group of people that I didn't know. 3 weeks of working with the same people in and out. They were very appreciative and very, very gracious. So I was happy to do it. In a heartbeat, I'd do it again.
Yeah, that sounds like it makes perfect sense why you'd want to stay longer, to kind of get an understanding of where you are. It's funny that you brought up the tax concern. I know from freelancing and working in New York too, that yes, once you reach like a certain threshold, working in another state, you do have to pay state taxes, which is unfortunate, but not uncommon, I think. Rusty, any last thoughts on your experience in New York and what you learned while you were there, and anything else you want to tell the community today?
I was thinking a little bit about it, and the things that I learned were really more reinforcements of things that I already suspected. That we're people, and a community in crisis needs caring people to come, participate, help, serve, do so with to have it be a pleasure to do so. And when you do so, people are pretty intuitive. They appreciate when you're authentic. They appreciate when you're giving, and all of that was kind of reaffirmed in the process. That whenever you look at Intermountain Healthcare sort of vision and caring guidelines and principles and the things they do, when you implement those almost anywhere, it has value. People are intuitive enough to know that if you're authentic and you care, it comes out over time. So in terms of the clinical impact, how will this impact the way that I things back home here? Because I know part of what we were hoping to gain in the process was clinical experience about how to deal with things in an overwhelmed hospital environment, in this sort of pandemic atmosphere. And I don't know that I gained a a whole lot of specific insight. That is, Utah's had the privilege of having time to prepare, and preparation is the number one factor. And so we've had that luxury, and that's a blessing. I don't have any special insight to bring to that. We worked with less PPE, and at my hospital here at Dixie, when we take care of COVID patients in the ICU, we have these they're called PAPRs. It's a positive airway pressure mask that we get to wear. It provides both air circulation and helps keeps particles from getting directly on your face, and it's all done through a HEPA filter. Well, I didn't have access to that. I had to wear a mask that was uncomfortable, and yet I was only doing what others had been doing for weeks. And so I think the things that I gained was I appreciate the things that we have access to that Intermountain has put together, Intermountain Healthcare. But I also see that they're luxuries. So we have certain luxuries here because of our resources and how well organized our system is that are truly luxuries. And so I think it reminded me that you want to work with gratitude wherever you are. In terms of I think that's the biggest deal. If you're in healthcare, you're in a profession where you take care of people, and you want to do that with compassionate care being your number one priority at all times. Because the reality is there are always people who do what you do and get paid more to do it. And if you look hard enough, there are people who do what you do and do it without being compensated at all. So in life, there's just always a range of opportunities and areas. And so, but especially in healthcare, your heart has to be there to provide compassionate care for those who are often, especially in critical care, at their most vulnerable. And that was just reinforced while I was there. I saw the impact of inadequate staffing. People didn't get turned enough who were basically bedridden in the ICU, so that you had more pressure sores and skin breakdown and things of that from a clinical perspective, I was like, okay, this is why we turn and rotate patients and change positions and do things. So I got some reinforcement of things that I was already familiar with, but hadn't seen a lot of the detriment that happens when they're not implemented. So I guess it made me more appreciative of the resources and staffing that we have. But I guess those are the biggest things.
Well, Rusty, thank you so much for sharing your experience with us. We really appreciate learning about your experience there and get insight on what happened. And if anyone is listening would like to get screened or tested for COVID-19, you can call our COVID-19 hotline at 844-442-5224. We also still have our emotional health hotline available. You can call that phone number 7 days a week from 10 a.m. to 10 p.m. That 843-442-22. Thanks, Rusty.
Thank you so much.